Hello, my name is Ron Rogge, and I'm a professor of psychology at the University of Rochester. I want to show you some monthly diary data collected over the first 6 months of the pandemic here in the United States. So COVID-19 is not only a worldwide health crisis, but the lockdown and distancing measures we put in place to flatten the curve have created mental health challenges worldwide. I wanted to look at sex and close relationships as sources of either resilience or risk for individuals. I used the EVSA model, which posits that stressful events, like things related to COVID, create challenges and that individuals must then respond to in either adaptive or maladaptive ways that then shape their well-being. I wanted to look in this study at sexual health and relationship health as key adaptive processes in that response to the COVID pandemic. So the monthly diaries assessed stresses related to COVID, and we modeled them predicting corresponding changes in sexual health, which predicted corresponding changes in relationship health, which predicted corresponding changes in individual well-being. We did this with a series of online surveys of sexually active adults, and a variety of recruitment methods was successful in recruiting over 1,600 respondents in about the first 2 months of the pandemic here in the United States. 82% of those baseline respondents gave us emails and were invited to complete follow-ups, and about 59% of those individuals did, providing an average of 3 waves of follow-up. I tested my models by building multi-level models. At level 2, I modeled stable between-person differences across the 6 months of the study and looked at how those stable differences were related to one another across these various constructs. And then that allowed me down at level 1 to look at how fluctuations in individual variables were linked to corresponding fluctuations in other variables. So the results at level 2, looking at the stable levels of these variables across time, stable levels of COVID stress, predicted just about all forms of health we looked at. Most of these links were negative in that they predicted worse sexual relationship and individual well-being. Although a few paths came out in the opposite direction. Higher COVID stress across the 6 months of the study predicted greater communication of affection and greater relationship satisfaction, suggesting that maybe people valued their close relationships in this crisis. Also, cabin fever predicted higher sex drive. Consistent with the EVSA model, we found that COVID stress also predicted the outcomes by shaping sexual health, which in turn shaped relationship health, and by directly shaping relationship health. Down at level 1 now, we looked at this same model, but now we're seeing that shifts or spikes in COVID stress led to corresponding shifts in all of our outcomes, although most of those were in the direction of reduced well-being and health. Spikes in COVID stress led to corresponding spikes within specific months of communicating affection and relationship satisfaction, again, suggesting people valued their relationships. Spikes in COVID stress were related to poor sexual health, which shaped outcomes. COVID stress also shaped outcomes through sexual health and then impacting relationship health and through shifts in relationship health. So our results supported the EVSA model. Thank you.